So this is a very special webinar series because this is the month for autism awareness, and this is a good time to know more, understand more about autism, about various aspects of autism, how it can be diagnosed early, why does it happen, and what are the treatment options available. I'm sure you have been privy to many of those other autism webinars which have been held on this platform and have become more knowledgeable in this month. Also, this is a very special and critical time for all of us. We are all we are all going through this very difficult time of the COVID pandemic all over India, all over the world, and more so difficult because we have children with special needs, we have children, even though they don't have special needs, are difficult to manage inside home, even for adults is difficult. So I hope you have all have found different coping mechanisms, different ways to keep your children entertained, keep your children educated, as well as keep them safe. So most important, be safe, take care of yourself, and as life restarts, we always have the options which were always available to us before, and we have taken them for granted. So let me get on to the topic quickly now. The topic that has been chosen is very exhaustive. It's very huge. It's very lengthy. So at the outset, I would request your patience to go through, to be there throughout, because I'm going to not only talk about the causes, possible causes, a little bit about early diagnosis, but also different options for treatment which are available, and a whole lot about regenerative medicine or stem cell therapy, which people are very inquisitive about, but it will be at the end of the talk and the best at the end. So to start with, you all know what autism is. Autism basically is a triad of symptoms, which autism means, means self, autism means involved. So these are children or individuals who are self-involved and thereby have problems with communication, with social interaction, have restricted repetitive behaviors and restricted activities, thereby all of these together prevents their functioning, achieving social milestone as well as educational milestone sometimes. It is a neurodevelopmental disorder, as is now well established now. Earlier it was thought that it is a psychiatric disorder. However, we know now that the problem is a developmental problem. It is the problem when the brain is developing, the wiring or networking or functioning of certain areas is not optimum. And I will be talking a little bit more detail about which areas of the brain is affected. Somehow, very strangely, it seems to be more prevalent in boys as compared to girls, and it is a spectrum. That's why it's called autism spectrum disorder. They can be mild symptoms, they can be moderate, and some individuals can be severely afflicted. As I said, triad of problems. So this triad of problem leads to a whole lot of issues. And the tip of the problem is, of course, speech, because that's what parents see, that the child cannot speak. However, you have whole of these other problems, inappropriate behavior, either hyperactive or passive. So there can be either very, very, very challenging behaviors like running around all the time, or very quiet and subdued. Inability to relate to others, inability to follow commands, though they can hear. So all the functioning of the hearing capacity is there physically. If you look at the ear, if you do the auditory testing, everything is fine. But somebody don't want to respond. There is no motivation to communicate. There are inappropriate emotional responses, either too much laughing or too much crying. Sometimes oversensitive to various sensations, or sometimes very undersensitive to sensations. Lack of speech or articulation is sometimes a problem. Awareness about the surroundings, awareness about danger, response to stimulus is the main issue. Whatever information they are getting, they are unable to process and respond to it appropriately. And why is it important to understand? Because look at the numbers. If you look at many of these countries, most of these countries, the numbers, if you look at the statistics, are very, very, very high, and thereby it is important that we understand this condition better in order to try and prevent, if not prevent, try and reduce the severity so that children can be mainstreamed. They can be empowered to be able to lead an independent life. So everything that we are going to talk today is towards helping a child or enabling a child to be able to uh, have an independent life. Their prevalence increasing in epidemic proportion, just as the COVID is increasing every day. Here it is increasing, and we don't see any way that it is decreasing. Every year you see an increase. Look at 2004, the CDC Atlanta data shows 1 in 166 prevalence, and now in 2018, 1 in 59, which is really very high and alarming. So 70 million individuals are on the spectrum in the world. It is 1% of the world's population. So now the question, parents saying, mothers saying, what is the problem? Why my child? What did I do wrong? What happened? How do should I have known earlier? How could I have picked up earlier? So let's try and understand, and let's try and answer a few of these questions. So what are the red flags? We have a normal developmental milestone achievement: physical, emotional, cognitive, social, right? So physically, generally, these children are in fact pretty fast, sitting, neck holding, sitting, walking, most of the time on time, but they don't respond appropriately. When we call them out, they may not respond. So not responding to their name by the age of 12 months, not able to point at objects if they are interested in, right? If they don't show interest in certain things that normally children show in, they don't like to play do pretend games, or they don't like to play interactive games. They avoid eye contact. They like to stay alone or aloof. They have trouble understanding people's emotions, like somebody's crying, somebody's laughing, they're unable to respond to it. Speech is delayed. Many children, many parents say that my child had good speech, had good vocabulary, would respond also, but suddenly there was a regression. But maybe if you look in deeper, there may have been a few of these at least red flags, which now in retrospect you may think, oh my God, yes, I missed this. So delayed speech and language skills. So speech doesn't just mean repeating what you are saying. It also means comprehension along with language appropriate for socialization. Repeating words or phrases again and again. So that's called echolalia. If you say something, child keeps on repeating, just finds it very funny. Gives unrelated or irrelevant answers, irrelevant vocabulary. Sometimes you think it is a jargon, it's a child jargon, he's a child, and so that's why he's just having nonsensical words, and the normal words will come out. Obsessive interest, it likes one thing, will continue to like that, or maybe do things such as lining up chairs, or lining up cars, or lining up round things, lining up elongated things. So will have obsession with certain things. And stimming behavior, clapping hands, rocking the body, going around in circles, because these are inappropriate responses to external stimulus. Have unusual reactions to smell, taste, look, or feel. You know what the appropriate response is. You will know that. So if a few of these appear to be there, then you go to a developmental pediatrician, you go to a psychologist to get a screening test done, and they have this whole list of questions. They will ask about 40 to 50, and depending on what appropriate responses you give, the scoring or evaluation of possible risks for autism can be picked up early enough, as early as 2 years old. So it could be a risk of autism. So earlier, so there were different categories or different ways that a child would either be called as being an autistic disorder, or would be either Asperger's or Redd's or PDD-NOS. These are different diagnoses. But now under these DSM-5, the updated manual, these are now all come under the autism spectrum. Now, causes. Everybody wonders, is it genetic cause? Is it an environmental cause? Did something happen when I was pregnant? Did something happen before? Especially mothers tend to feel very guilty. But sometimes no mother or no parent wants to do anything wrong to their child. They are always, a child is a source of big joy whenever a couple conceives. So sometimes even if you do understand the cause, it may not be in your capacity to try and prevent it, but we could try understanding so that you know the possible ways things can happen. So genetic factors and environmental factors. You must understand that most conditions, most diseases in mankind or human life do have both these aspects. Like even if you take common cold, okay, I have predisposition for common cold. I have predisposition for allergies, and it is genetic. Right? My mother had, my father had. My father used to like sneeze a lot every day in the morning, so he had predisposition for allergies, and I have inherited those predisposing. But doesn't mean that I have that completely? No. There are environmental factors which would trigger, and I can try and prevent those that from happening to me. I can't change my genetics because I can't choose who my parents are, but I can change my environment. Okay, I can make it more robust. I can make my body more stronger to prevent or reduce the effect of my genetics. So yes, there would be genetic factors, there could be environmental factors alone, or there could be a combination leading to autism. It is a multifactorial condition. So genetic involvement in ESD, how do we know? Because we have seen in a family having two sisters having this condition, three boys having this condition. So triplets and not only twins, sisters, siblings, one after the other also. So somewhere there is definitely a small part of genetic condition, and there have been a whole lot of genes which have been studied, are being studied to see whether they could be causative of autism. So multiple genetic factors have been implied. However, when we look at if thousands genes have been implicated, they have been these have been found to alter the synapses or the connectivity, and this has been used to see whether drug can be made or discovered using the mechanism of action of these genes to see whether we can find drugs to actually treat this condition. But having this genetic condition, you really cannot change the genetics, as I keep on saying. And though these have been evaluated, no particular gene has been found to have 100% cause and effect. Okay, so these could be predisposing to certain autistic traits. So what are the environmental factors? I always feel that it's for academic purpose, for understanding, for knowing genetic causes is good to know, but it is not essential. But what is essential is to know, understand what are the environmental factors, because these are things which are in our capacity to change, which are in our hand, and we can modify the environmental factors to a certain extent. So there could be prenatal and antenatal causes. What does that mean? For example, in developing countries, many times the mother's body is not ready, mother is weak, may have infection during pregnancy, could be anemic, could have gestational diabetes, could have a lot of stress, hypertension, age of the mother is more, age of the father is more. So these are certain conditions, and during birth there is a problem, and I will be touching briefly on a few. Intestinal dysfunction and autism is something which is really, studied a lot and is being used a lot for treatment also. Now, there are various theories. There are some theories which say that yes, the intestine of children with autism, there are some imbalances. So some of the good bacteria are not there. There are too many yeast-producing organisms, and which could potentially contribute to the autistic symptoms. I feel personally that they can't really cause autism, but they can stimulate or they can aggravate the problem a child faces, again, which I'll be talking about in a couple of minutes. Exposure to toxic chemicals in the environment, use of mobile phones, possibly it is still, we will see whether there is any truth to that based on the scientific data available. So prenatal and antenatal causes. So as I said, maternal infection during pregnancy, rubella or torch infection, it's something which should be routinely tested. A mother should be tested for when she is pregnant. Diabetes, gestational diabetes, depression or use of antidepressants during pregnancy, age of the father or mother if it is higher or lower, premature birth and birth complications. So it is being seen that if the father is very old, there is 3.5 times more possibility of a child to have autism and 13 times more likely to have ADHD. In a younger father also, below 20 years, possibility of risk of autism is there. So these are certain publications which shows not only autism but other neurodevelopmental conditions and psychiatric conditions may also be associated with the paternal age. These are certain other publications related to schizophrenia and autism. Even grandparents' age is also responsible sometimes, says gastrointestinal issues, gut microorganisms. So autism, the gut microorganism may lead to inappropriate gut metabolism and will lead to modulation of mood and behavior, may affect the immune system, may affect cognition and behavior. But if you put it in a very simple way, I give an example. Suppose you have constipation and or you have loose motion. How would you behave? Would you be quiet? Would you be happy? Would you be in a very good mood? Would you be able to concentrate on your work? No, right? Similarly, if you just imagine a child with autism having gut problems, having gas, having loose motions, having discomfort, having constipation, and this child cannot express his problems, how would he be? He would be irritable. He would not be able to sleep in the night. He would be hyperactive. He would be restless. He would not be able to sit in one place and concentrate because all he can think of is he is having discomfort. So all of these, yes, gut does affect your own temperament. And yes, in the long run, if you have a bad GI tract, absorption of food will definitely get affected and nutrients absorption would get affected. In fact, there is a very interesting study. Rather than the child's gut, it appears that a pregnant woman, a mother who is pregnant, if her gut has a problem, there are certain antibodies which are formed in the gut which tend to affect the brain development of the child. So there is some study, there are certain studies going on in rats and mice which have shown that the mother's gut issues could contribute to the child's brain development being affected. So this microbiota gut brain axis, so there are certain new therapies or treatments which are coming up to address this. Many parents do ask me about this, though we don't have so much experience in correcting using newer techniques like fecal transplant. But nutrition is very important. Absorption of vitamin B, absorption of and formation of vitamin D. All these things, of course, would affect your overall brain development. Now, exposure to electromagnetic fields in use of mobile phone, it is a controversial topic. If you look at when the child is in the mother's womb, it has been postulated that if the mother uses the phone too much and the electromagnetic rays reach through the mother's womb, if the phone is held too near the womb or the abdomen, it could cause changes in the brain leading to altered brain activity. So it is suggested that use of phone should be reduced. Now, these are various studies which have shown that there is possibility of learning difficulty and attention and behavior problems in young people due to use of mobile. And there could be change in the genetics and epigenetics due to overexposure to electromagnetic fields. But there are electromagnetic fields everywhere. One wonders how much can you avoid? uh, but current data is insufficient to conclusively say that it affects. However, uh, um, most of us now have a theory, and most of the doctors and even the therapists advise that, you know, whether you've used a mobile phone a lot during pregnancy or not, don't give your child mobile phone as much as possible. It's now become a default. The phone has become our default friend, and we, what to say, transfer our friends to our child, right? When the child is born, when the child is few days old, we start using the phone to entertain the child. And when the child is 1 month old, 2 months old, 6 months old, now the child stops eating unless you give the child a phone. Okay. And when the child is 2 years old, you find the child is completely immersed in the phone, and you say, oh, my child has got addicted to phone. Then I ask you, who gave the child the phone? The child has not gone to the shop and bought it, right? So now the child has become an introvert, is now focused, and here, if there is a little bit potential of the child having autistic symptoms, it aggravates because of use of the phone. Now this is more a social effect of the phone rather than the epigenetics. So there could be an epigenetic effect, but you cannot completely, ignore the social effect of using a mobile phone or telephone. Now, association of heavy metals with autism. Now, heavy metals, it has been seen that increased exposure, not normal exposure, increased exposure for heavy metals like lead and mercury, especially, has had effect on brain development. And so there are various theories about it. Very early on, when I was doing my graduation and post graduation, I was part of a study which was in the Indian scenario, actually looking at the blood levels of lead and the brain development. So we started as early as when the child was 3 days old. I remember myself looking at the various reflexes of children 3 days old. How are they different? And at the same time, studying the cord blood of that child and correlating it with the lead levels, because lead is used a lot by the mother in terms of making something known as a kajal or a surma. Then we have lead, which is contaminating the petrol and the diesel, contaminating the soil, and lead in the water, and so much exposure to lead from environment, and whether that is causing various brain neurological disorders, and there was found to be a correlation. So when the child's brain is very young, and at that time the child is exposed to a lot of heavy metals, there is a possibility that brain development may be affected. The other postulation is that the children with autism are unable to detoxify themselves. So if you look at, actually, if you study the lead levels or mercury levels in the family of a child with autism, you may find an increase in everybody's blood levels. But the theory is that a child with autism is unable to detoxify or remove that heavy metals, and thereby you have this new treatment of using chelation to remove the blood levels, the heavy metals from the blood. So there is a correlation, but how much lead would cause brain damage to exposure to how long is understood in for a few metals. Like for lead levels as less as 10 microgram per deciliter can cause apparent learning and defective neurobehavior is one understanding. Chromium level, cadmium level also has been found to be higher in children with autism. So mercury toxicity uh, uh, is seen in some children. So in not all children, but yes, this is one of the possibilities. Aluminium. So from aluminium, the possibility of aluminium or mercury toxicity came the theory that vaccine could be associated with ASD. Now, it was way back in 1998 that this suggestion was put forth by Wakefield, a scientist in the US, Wakefield and his group, and what they suggested that MMR, the mercury content, which is used as a preservative in the MMR, is causing the damage to the intestinal lining and thereby weakening the immune system. However, after that, there were about 25 studies which showed that this is not possible, and vaccines do not cause autism. However, once that thing has got embedded in a parent's mind, the vaccination has become the one of the biggest what to say villain in the autism field. However, as a doctor, and of course comes with a disclaimer, as a doctor, I would not recommend to withhold uh, vaccines, because you are doing your child more damage by withholding vaccines rather than by giving it, because these vaccines help prevent or reduce the possibility of a whole lot of infectious diseases which can be prevented not only for your child but can be reduced in your community only through vaccination. So please do your research much better and in a much more intelligent way before you decide not to give vaccine to your child. There have been families who have come to us where one child was found to be autistic and the sibling was not given the vaccines. However, unfortunately, the sibling also turned out to be autistic. So that we can't really pinpoint saying that the vaccines are the issue. Now, what actually happens in the autism and what happens in the brain? These are various theories. One is that there could be mitochondrial dysfunction, there can be chronic inflammation, there can be a lot of toxins causing stressors, there could be oxidative stress, immune dysregulation, hormonal imbalance, especially later in the teenage life, imbalance of again various neurotransmitters and dysregulation of the neurotransmitter pathway. But these things are something which are okay to hear in academic way, but what actually happens in the brain? Okay, so generally it is said when you do an MRI, the brain is normal, the structure is fine. When you look at the brain, okay, so this is the brain, okay, this is the brain, and you see the brain, you do a MRI scan which shows that everything is in its place. Oh, this is the main brain, the cerebrum, the cerebellum, everything is in its place. So what is wrong? We couldn't find what is wrong. So that's the major worry in individuals and parents not able to understand what is wrong. So let us understand the what does an MRI mean. An MRI shows the morphology of the brain. It shows the structure of the brain. Okay, so what does this mean? If the MRI is grossly or broadly normal, it indicates that all the structure is fine. So it's like you have a table and you have four legs. So all the on the surface it appears that the table is solid. It looks proper in structure, but we don't know the functioning. Okay? We don't know how well this works. We don't know whether these neurons are firing. We don't know whether these neurons are connecting appropriately. Okay, so that's why we went ahead. This is original research done by Neurogen Brain and Spine Institute. We went ahead to understand what is wrong in the brain of a child. So because the MRI is showing the morphology, we went on to study the metabolism of the brain or the functioning of the brain. And what you are seeing here is the brain structure. Right? This here is the front part of the brain. The back is here, back and down. So the green and the yellow and the red indicates normal to higher metabolism. So green is normal metabolism. And the blue, the light blue to dark blue to black indicates hypometabolism or lower functioning brain. So you can see in the center here is a low functioning brain, down here is a low functioning brain. So certain parts of the brain are functioning less. And what does it mean? I will be telling you. So this is a PET scan showing low functioning brain. So this is the baseline data that we understood. We studied in our institute using PET scan, which shows that functioning of the brain is affected. And we found that it differs from a neurotypical child, the functioning of a brain child with a typically developing child and brain development in a child who is autistic. So based on the brain functioning, various strategies are now being developed. But before that, These are not new treatment strategies. ABA is been there for a while. Art-based therapy, animal-assisted therapy, occupational therapy, physical therapy, speech therapy. You have heard of all of this, and in fact, I'm sure there have been a series of webinar, really covering all of this. Chelation, a little bit, I'll speak about that. Diet and nutrition is important. Neurofeedback are now newer strategies which could be considered, HBOT, and finally stem cell therapy. So I'm going to touch a little bit of each of these, but talk more in depth about stem cell therapy. So ABA, you know what ABA is, applied behavior analysis, basically trying to change the behavior of a child, helping the child to understand what is right, what is wrong, and do it in a more scientific way. So that these help the child to learn appropriately, to not throw tantrums, hopefully if used properly, and to be able to control impulses much better. Okay. Using various techniques. Occupational therapy, very important to help child understand how to basically learn how to take care of himself, activities of daily living, sensory integration, because mainly it's a sensory processing disorder, and information maybe input may go in, but processing of information and output seems to be most affected in children with autism. And these are, of course, the art-based therapy. And recently there was a webinar on art-based therapy. A child, you play, you teach the child with art and music, and child loves it, and learning is enhanced. Animals are very sensitive, and there are different animals being used to make the child more empathetic, to be able to, because they're non-judgmental. So the child of autism who is unable to find a relation or to develop a rapport with other human beings develops better rapport with certain animals. So those can assist the child uh, uh, to get us the sense of self-esteem and bonding. Speech and language therapy, very important, but the concept is now changing from um uh, just speech development to communication. So it's very important to teach the child to communicate appropriately. Physiotherapy in autism, new concept, not very new, but relatively new, because we know that it is not, they do have motor issues as well. They have posture issues, children have posture issues, they have coordination issues, hypotonia, gross motor as well as fine motor skills. So all therapeutic physical training becomes very important in order to enable the child also to concentrate better, sit in a better posture. Fidgetiness reduces, child's restlessness also reduces, balance improves, coordination improves, fine motor activity. All these can be helped with physical therapy. Aquatic therapy. Children love water, and water has so many properties that the child can be helped by improving blood circulation, improving learning, memory, coordination, balance, reduce hyperactivity, restlessness, improve proprioception and vestibular stimulation. So aquatic therapy has a lot of positives, and if you have those possibilities, do try and encourage your child. And there is a lot of scientific evidence which is coming out about the role of aquatic therapy in children with autism. So these are a few things which are done at our center for children with autism and other neurological conditions as well. Diet and nutrition, important in any condition, and more so in children. More than just gluten-free and casein-free diet is something that, yes, you can try, but important is that what should be avoided. Sugar, refined sugar, please do avoid, because that tends to increase the hyperactivity of a child. Normal child also, if you give too much sweets to a normal child, the child becomes extremely hyperactive, running around, doesn't sleep properly, doesn't settle down. And give wholesome food. Give a lot of vegetables that helps the bowel movement to clear. Try to give vitamin rich food, give natural food, give food which are easy to digest with a lot of probiotics and prebiotics. Ketogenic diet, generally more applicable for those who have seizures, but it's difficult to follow through. Chelation, which is related to the heavy metals, this is something being used. how well it is effective, or whether it can be given safely in children, is still being understood and debated. But this is a theory, and there are certain papers which do say that oral DMSA can help safely to remove toxic metals and help to normalize the platelet count, as well as normalize the RBT glutathione, thereby improving the oxidative capacity of the RBCs. But there are certain studies which do not show improvement, and some do show. And so there is a there are mixed views about chelation. Hyperbaric oxygen therapy, most of you know what it is. It is a pressure cooker kind of a scenario where under increased pressure, oxygen is pushed into all the cells of our body. When we breathe normal air, only certain amount of oxygen can enter our cells, which is okay for routine work, but for healing purposes and reducing inflammation, in pressure at oxygen at increased pressure needs to be pushed into the body, and that's the way that hyperbaric oxygen work. It has been seen to work very well for certain neurological conditions, certain immunological dysfunction. However, the recommendations are different. I have put together certain papers which say no, that it is not reproducible results, and some say that the results are good. So these are 3 papers or reviews which say that really there are no long-term effects. However, there are papers which say that, like in Thailand, this paper has been published which says that it has helped children relieve certain symptoms. In Egypt also, this is a paper which shows that it does help improve the blood flow in certain brain areas. So though reviews don't recommend, but efficacy has not been completely established, but it is found to be relatively safe with few side effects. Okay. Now neurofeedback is another method. What does it do? Actually, it is based on brain waves or electrical activity of the brain. It is a non-invasive procedure where regulation of brain activity using certain frequency of waves. So what does it do? The brain activity is first recorded using a QEEG and then using infrared rays. If the brain activity, brain wave pattern is slowly brought to normalcy, and thereby it helps to reduce hyperactivity. It has to be done multiple times. It is a series of neurofeedback sessions. Attention problems, anxiety, processing of information is improved, sleep disorders. So these are some papers have shown all these improvements. But if you look at all of these approaches, you see that rehabilitative measures very important, cannot substitute for any kind of any other treatment. Dietary approaches, other complementary alternative medicines, all these help the brain from outside. But the core pathology of autism, which I will be again discussing, and I showed you in the previous PET scan, is that those areas, there are certain areas in the brain which are functioning less, and we need to address those areas. We need to help heal or improve the functioning of those areas. So let's look at autism in a little bit different way, how to understand autism, look at PET scan better, and then see whether stem cell has any logic to it. So this is, as I said, original research, and where we find that certain areas. Now this is area deep inside the brain known as a mesial temporal area. The mesial temporal area consists of hippocampus and amygdala, and this is the cerebellum, which is in the back and down. Now these areas, let us look at what is the functioning of these areas. Okay, so mesial temporal, hippocampus, cognitive function, understanding, memory, retention of memory, comprehension. So children with autism have these problems. Amygdala, social interaction, emotional expression. Cerebellum, coordination, fine motor activity, articulation, sensory issues, and multitasking. So these are the 3 major areas which have been found to be affected using PET scan, and you can see that it correlates beautifully with the symptoms or the problems a child with autism has. So earlier it was thought that uh, autism is a psychiatric disorder due to emotional disturbances. But now with advanced neuroimaging, we can see that there is a disorder. It's a disorder of problem during development of the brain, prenatal and postnatal brain development. Earlier, it was thought that autism is a static disorder. That once the problem happens, it remains the same throughout life. However, we have found when we are looking at the brains of children with autism over a period of time and at different ages, we find that the brain which has developed to a certain extent and is lacking tends to become worse after certain years, and that means there are progressive changes for the negative, as well as uh, also, paradigm shift in understanding using neuroimaging brain structure is earlier it was thought that there is no structural or functional problem in the brain. And now with imaging, we see that the volume of the brain as well as the functioning of the brain tissue will be affected. So this is the baseline study which was published in the World Journal of Nuclear Medicine. And these are the different brain areas which are involved or functioning less. And as I told you, here is the cerebellum, the small brain. Okay, the frontal lobe, again, it is important for emotion as well as intellect. You can see the parietal lobe in certain, this is more for motor function, thalamus, which basically connects the two parts of the brain as well as. So when we studied about 85 PET scans between the age of 2 to 23 years old, we found that, let's look at this graph very carefully. This light green graph here you can see is that of a neurotypical brain. You can see that the child's from the age of say 0 to 10, the brain development is increasing or the cortical metabolism is increasing steadily and uh, in a good speed. And after 10 years also it is increasing, but it slows down. So we know that the brain development is faster in the first 10 years of life. And after that, though yes, the brain development is happening, it slows down a bit. Now, this is a graph. The blue one is the brain functioning of a child with autism. And these are at different ages. You can see initially, actually, the brain metabolism is higher in children with autism, but with age, it tends to go down. And at a certain point, you can see that as age increases, the difference between a neurotypical brain and a brain of a child with autism is so much different. So with age, the gap increases. So what does that mean? This is an evidence, or this is a recommendation again for what you call as early intervention. So early intervention is a concept which has been going on for a long time and means that if you want a child with autism to improve, you have to start therapies really early. You should not wait too long, and this is what is justifying it. And if you wait till the age of 10 years, you have a big gap to really reduce. If you start early, then the time taken to reduce the gap between a neurotypical child and autistic child is much less. So earlier you start any therapy, the better the results. So that's where comes the rationale for using cellular therapy. In cellular therapy, we use certain cells known as stem cells, which will help improve the brain functioning, help heal those areas which you saw as blue, improve the cellular metabolism, improve release of growth factors, which will help heal the brain and stimulate connections of the brain appropriately, thereby improving functioning of the brain. So there are many different inventions as the humankind evolved, which have helped us to lead a better quality life. And one of them is, of course, electricity, internet. All of this is very important, especially now we really appreciate what internet is doing for us. It is by improving our connectivity. When actually we can't meet each other, we can still meet and talk, right? So this has really changed the way we are living our life. Similarly, uh, use of regenerative medicine and stem cell has changed the way we look at incurable conditions, incurable disorders, and especially neurological disorder, which are the most difficult to handle. And it was earlier thought that once the brain is damaged, it cannot be repaired. However, this thought has been debunked by the use of recent techniques of cellular medicine. So there are various neurodevelopment disorders which can be treated, neurological disorders, and this is just to give a glimpse of what are the various conditions that can be treated. And to now understand what exactly is this tool, what are stem cells, because there are a lot of misunderstandings about stem cells, there's a lot of myths about stem cells, there's a lot of hype, there is a lot of hope as well. So let's try and really um, sieve it all and get the good and the bad away from each other, remove all the chaff, remove all the unnecessary things, and really get to the crux of the matter. Now, what are stem cells? Stem cells are very special cells. Stem cells are cells which have the capacity to multiply many, many times. And depending on where you put them, they can help regenerate, repair that part of the body. So suppose you take these cells and you put them in the liver, they can help improve the liver functioning. If you put them in the heart, they can help improve brain heart functioning. If you put them in the near the knee, you can help regenerate the damaged cartilage in the knee. So of course this is a bit simplistic, but this is just a overview of what stem cell possibly can do. Now, very simply put, stem cells are like stem of a tree. Just like stem of a tree give rise to branches and give rise to leaves and flowers and fruits. With proper, you must see proper growth factor and signaling. These branches can give rise to many. So stem can give rise to many branches, and then to different tissues of our body. So at one point of time, when we were in our mother's womb, we were all one cell stage, then two cell stage, and when it became a bunch of cells at the age of 3 to 4 days in our mother's womb, and we were all stem cells at one point of time. And from there, we became a child. And as we grew, the stem cells got used to make different parts of our body. So stem cells are ours, okay? So they made liver for us, they made kidney for us, they made heart for us. The whole body came from those stem cells. So, there's nothing to be worried about stem cells. They are nothing taken from, the other world. So as we grew, these stem cells work got over. We were born, and as we grew, our bones grew, our liver grew, our heart grew, our brain grew, and once we became adults, all these stem cells, their work got over, and they remained as a small, warrior who has finished their work and just remained there in a very small quantity in a quiescent state. They have earned their rest, and they will remain there till the body requires it in whenever there is an injury. Okay, but there are certain areas in our body which continue to multiply lifelong. They have no reprieve. Okay, like example, blood. When blood is being formed, we know that when we donate blood, more is formed. Blood is being formed continuously in our body. And where is it formed? It is formed in the bone marrow, and the bone marrow is in the hollow parts of our bones. Okay? So this is one example where stem cells are multiplying lifelong. In fact, even in the brain, it is understood that the brain is not done with its work, right? There are niches. These are called stem cell niches. There are niches in the brain which continue to multiply lifelong. And which are these areas? Just imagine if brain development or if the brain multiplication had stopped, how would we form new memories? Have you ever imagined? What are new memories? New memories are basically multiplication of the part of our brain which is responsible for new thoughts, new memories, new learning, and networking. So these are constantly forming new cells. And when these stop multiplying and networking, that's when we get Alzheimer's or dementia. Okay, so the brain is also multiplying. Certain parts of the brain is multiplying lifelong as well. So these are different parts where stem cells are multiplying. Now, how do they work? They multiply, as I said, they have potential to multiply. One cell can become thousands of cells. They, depending on where you put them, what kind of signal are you giving them, what kind of environment are you giving them, they can become those type of cells. They release a lot of positive chemicals. They release chemicals which can stimulate the brain. They can release chemicals which can help heal that part of the body where you have injected or where you have transplanted those cells, and they improve blood supply. So healing, all healing in our body occurs by the formation of blood vessels and releasing of chemicals, good chemicals as well as oxygen to that part of the body which requires to be healed. So formation of new blood vessels or angiogenesis happens with using stem cells. So what exactly is regenerative medicine? Regenerative medicine is a branch of modern medicine which uses various techniques or tools. One of them is stem cells to improve functioning of various organs or to regenerate various organs. Here we are giving an example of brain. You can see this is the brain, and you can see these blue areas, a PET scan showing damage, and in stem cells will go and stimulate these areas to function better, thereby repairing that part and improving the brain function. So now, what are the different type of stem cells? This is very important to understand the concept of stem cells as well as the controversy which surrounds it, because there is a whole lot of controversy surrounding stem cells. The beauty of the stem cell is somehow lost because of all these controversies and sometimes irrational thought processes that are going on in many of our mind. So as I told you, the first or the most primitive of cells is this group of cells known as blastocysts, from where the embryonic stem cells are created. So embryonic stem cells are basically cells which are processed in the laboratory from 3 to 4 days embryos from in vitro fertilization clinics. They are cultured in the laboratory and they form thousands and thousands and millions and billions of like-minded cells or similar cells, which has the potential to form any type of cell or any type of tissue in our body. So those are embryonic stem cells, and they have to be procured or they have to be created from embryos. And that's where the problem came. And these cells currently, due to ethical reasons as well as due to medical reasons, are currently not to be used for transplantation. There are ethical issues. There are certain thought processes. There are certain religions which have the understanding that life starts at conception, and when you're using embryos to make cells or make embryonic stem cell line, you are actually killing embryos, or you are taking away life. And those are the ethical reasons because of which there was a stopping of research using embryonic stem cells way back in 1998 or 2001. But also these cells tend to multiply very fast, very indefinitely, and have the potential to form certain masses known as teratomas. They are not cancers. They are not strictly malignancies. Yes, they are benign tumors. These are bunches of cells which, if you see under the microscope, you may actually see some cells pulsating like heart. You may see some cells forming network. You may see some cells producing teeth, some producing hair. So these are embryonic cells who have of their own become various types of tissues of our body, because that is their characteristics. If they don't do that, they are not embryonic stem cells. However, if we have to use those for any clinical purpose, we have to get rid of the potential of these cells to form tumors or teratomas, and that's where currently the science is. But when we go on, when the child is born, and the mother is connected by this cord. Okay, this cord is cut and it is put in the dustbin. This cord contains a whole lot of stem cells, whole lot of cells which are actually the property of the child, and which is a very very rich source or resource of stem cells which are adult, which will never form tumors, and which are the child's own cells and can potentially be used for that child whenever the child grows up. and has any problems. So that's a cord blood stem cell. But suppose we have not stored cord blood for our children, which is not always feasible, not always possible, we do have the option of something known as the adult stem cells. As I spoke to you a few minutes back, that our body still continues to multiply in certain areas. Our cells continue to multiply, forming new cells every day. One of them is the bone marrow. The bone marrow is a very good source of stem cells, which multiplies lifelong and has no ethical issues, no tumor formation. We are not killing any embryo, and thereby it becomes a feasible potential source of cell to be used clinically. Though it may not be as efficient in terms of forming different cells as embryonic, but it has zero potential of forming tumors. It has zero ethical issues, and thereby the risks are negligible or no risks. And thereby the adult stem cells from bone marrow, and now we have newer areas like teeth, we have dental pulp cells, we have also from the fat, adipose tissue. These different areas of cells are adult stem cells, which will circumvent the ethical issues of the embryonic stem cell and can be taken from our own body, can be used for clinical transplantation or medicine. So what does this slide tell you? This slide, what is it trying to show you or tell you? When we look at different types of cells, you must understand that when you're generalizing that stem cells are banned and stem cells have side effects, you are actually putting all of these cells in one basket. And for example, that you are saying that alcohol and homemade orange juice are all beverages, and thereby they are all toxic. Okay, so we need to differentiate the homemade orange juice from the alcohol. Embryonic stem cells could be anonymous or synonymous to alcohol, while adult stem cells is like homemade orange juice made by a mother with a lot of love and care, and so you will agree with me, is nutritious and doesn't have mother's love will not really harm the child. So we choose at Neurogen Brain and Spine Institute to work with adult stem cells primarily from the bone marrow of the same child. So it becomes safe. There are no tumor formation ever. We have been doing for 11 years now. No rejection issues. Easily obtainable with just one needle. No major surgery. No ethical issues because we are not killing an embryo. What is the scientific basis of stem cell therapy? Is it a quack? Has it come yesterday? No. There are three instances in the history of human research and human science in physiology and medicine that Nobel Prize has been awarded for the stem cell research. So you can understand that this is a growing science, which of course has a lot of misunderstandings attached to it. In 1990, the first time ever, it was Professor Thomas was awarded the uh, uh, Nobel Prize for demonstration of stem cells in the bone marrow. In 2007, embryonic stem cell derivation or isolation was awarded the Nobel Prize in 2007, and recently in 2012, a new type of stem cell known as induced pluripotent stem cell theory was awarded. Two scientists were awarded the Nobel Prize. So there's a lot of rich history, a lot of research behind, almost 50 to 60 years of research behind the science. So let us not, let's not take it very lightly. Even the Harrison Principle of Medicine, our textbook, our Bible for all medical professionals, also has a chapter on stem cell and gene transfer in medicine. So why are stem cells controversial? Because in 2001, George Bush, the president of USA, banned federal funding for embryonic stem cell research. So please remember this: embryonic stem cell research, not on scientific basis and not adult stem cells. And but in 2009, President Obama actually lifted this ban. The ethical principle for doing stem cell therapy is based on the Declaration of Helsinki for disorders for which there are no treatment options. And this is the historical speech given by Obama when he lifted the ban on embryonic stem cell research.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers. So seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So very inspiring speech by ex-President Obama. So even in the Indian Parliament, our ex-president has focused on research on stem cells. Our current Prime Minister went to meet the Nobel laureate to see how stem cell can be used to treat sickle cell anemia. So there's a lot of support to stem cell research and treatment in India right now. This is Neurogen Brain and Spine Institute, where the work which is done here will be presented by me right now in the next 10 minutes. So we've treated over 10,000 patients from 70 different countries and different neurological conditions that can be treated, but I would be talking only about autism. So scientific basis of the work that we have done is 100 scientific papers, 16 of them in autism in the last 11 years. How is the treatment done? Very, very simple. We take bone marrow from the patient's own body, from the hip bone. Bone marrow is removed from the hip bone using a very thin needle, and stem cell separation happens in the laboratory, injected into the spinal fluid in the back. So this is the process of the treatment. Very simple. Bone marrow removed from the patient, not from sibling, not from relative, because here we know that when we use cells from the patient's own body, they are 100% safe and there are no side effects. Cells are separated on the same day. There is no culture, there is no storage, and injected using a very thin needle in the back into the spinal fluid. So bone marrow aspiration, separation. Bone marrow is like thick red blood. It is processed, and here you can see what we get is millions of cells looking like cotton coffee bundle. Checked and then injected into the back, into the spinal fluid. Now, when we inject the cells here in the back, these cells go up to wherever the injury is, in spinal cord injury in the back or in the brain where the problem is, and help improve. This is through the CSF and help improve the brain functioning. So this I've already said. So these are different reasons. There is inflammation in the brain. We are already crossed the blood-brain barrier, 2 layers when we are putting into the spinal fluid, and the last layer, which is the thinnest layer or the pyometer, is already porous because of the inflammation in the brain in any neurological condition. From there, the release of neurotensin and corticotrophin will attract the cells from where they are injected, and the cells can pass the blood-brain barrier and reach the part of the brain which is affected. The work that we have done, the first ever, so what is the world literature? There are 19 publications in the world which have shown 71% success rate in autism. The first ever publication, it came in 2013 from Neurogen Brain and Spine Institute, where we showed in 32 patients significant improvement. The second came from China using cord blood stem cells, which also showed that the cells are safe as well as potentially can be used for improvement. The third paper came from Italy, where they used fetal stem cells and showed that it was safe as well as effective. The fourth and fifth came from United States, one of them from the North Carolina Duke University using cord blood stem cells, which shows significant improvement, while the second one shows that though there is improvement, though it is safe, the improvements or significant improvements still need to be shown. So these are the published results. The sixth and the recent in 2019 is again from Neurogen with the 200 plus cells, and I will be just sharing with you these two publications from Neurogen. So this is the first ever publication in Stem Cell International. So I'm going to talk to you only about the published data. So sample size of 32 patients, which showed improvement on clinical scale of ISA and global index. All the ISA, the different domains have shown significant improvement in all aspects. We generally find the child is much more amenable to being taught learning and comprehension improves beautifully, attention concentration, ability to communicate, sensory issues reducing, eye contact improving, and overall there is an improvement. Sorry. Publication number 2, which is a recent publication of 254 patients, where we see that social interaction improves in more than 50% of patients. Again, eye contact improved in almost 70% patient, attention concentration improvement very well, sitting tolerance, command following. These are major improvements which are seen. Reduction in aggressiveness and stereotypical behavior seen in almost 40 to 50% patient, communication improving in about 50% patient. So overall holistic improvement in various features. I generally find that whatever it's important to do therapies along with stem cell therapy, and when you're doing it in a combinatorial fashion, you see that all the therapies that you were doing before with stem cell, they give you better results. So there is an acceleration of the results along with stem cell and intensive rehabilitation. We always emphasize that therapies need to be continued along with stem cell therapy. These are the SCORE, ISA, and CARS, which are used to do pre-assessment as well as post-assessment after 3 months and 6 months, showing significant results. Now, when we look at the outcome based on severity of the condition, age, gender, and diagnosis from the time intervention after how many years of diagnosis. So when we look at patient at the age, severity of the patient, we find that moderate patient, mild and moderate improved to 93%. So that's a good improvement. Age-wise, we see less than 5 years improving almost to 97 to 98%, 5 to 10 years, 94 to 95%, 10 to 15 years, around 90% improvement, possibility of success. So what does that mean? That out of 100 children that we treat, the best results are in those who are below 5 years, second best, of course, 5 to 10 years. So this is a logical progression. You do understand that as the age increases, possibility of success reduces slightly. The earlier you treat, the better the results. So if the child was diagnosed today, and if you do treatment within a year of the diagnosis, you get almost 100% result. Between 1 to 5 years, a 95% result, and after 5 years of diagnosis, about 90 to 92%. When we looked at the objective understanding or screening of what happens inside the brain using PET scan, we do see objective improvements. Now, this is the brain scan before the treatment. The left side, you can see these blue areas here showing lower metabolism, as well as here. Please look at my cursor. You see that green indicates improvement in functioning. So you see an improved functioning in the brain in this. Here you can see before the treatment, after the treatment, you can see the blue areas are improving. Here you can see over a period of 3 years. This is the first scan. You can see the brain is like a mottled appearance. And here also you can see the light blue areas. These are low functioning areas. Okay, here you can see thalamus, the center of the brain, connecting to right and left parts of the brain. After 1 year, you can see the blue area has become green. Okay, blue area become green, and you can see sustained improvement. So whatever improvement has happened, it remains after 3 years as well. So we see that the improvement continues and sustains. It doesn't regress back. But yes, there are a certain percentage of patients who do not improve. It is not a 100% success rate. So why 10% patients do not respond or may regress? Sometimes we see in older patients. Generally, that the success is lesser. We find that those who are in the hormonal phase, in the pubertal phase, that's the most challenging phase, because your results are confounded by the hormone surge that you see in a child. High-grade fever, if there is high-grade fever, the brain does get affected, as well as the stem cells. A lot of emotional issues at home. There is no consistency. There is a movement or change of atmosphere before the child has been able to recover. There are too many changes, bullying, and maybe high metal content containing medications. Like sometimes Ayurvedic preparations do have high metal content. So generally we see problems during puberty, and high testosterone level could be, we have seen that with age the severity of the problem also increases. It is important that good rehabilitation happens along with stem cell therapy. Good nutrition, good rehabilitation helps the improvements. Contraindications: when can you not do the stem cell treatment? Is if you have malignant tumor of cancer of any kind, weight is very less, hemoglobin is very less, if you have any viral infections, active viral infections or chronic viral infections, these are all absolute contraindications for cell therapy. These are all the publications and Neurogen publication, chapter written in our books, and a few case reports to make you understand the kind of improvements that can be seen. So this is a story of a 14-year-old male from the United States. Father is a doctor, mother is a nurse, and he's typical autism with regression at the age of 2 years. He had poor attention, concentration, problem solving was not age appropriate, irrelevant laughter, difficulty in maintaining eye contact, and sometimes self-injurious behavior, unclear speech, a lot of sensory issues, required help. So he improved from initially mild to moderate to slowly after every treatment, after his first stem cell treatment, after 3 months, we saw a lot of improvement in his following of instruction, sitting in class for a longer time, improvement in his quotient awareness, learning, sensitivity towards others, the problem behavior like restlessness and walking around reducing, having appropriate conversation, sensory issues becoming lesser, appropriately answering, learning, academics, as well as language. He started learning Spanish apart from English, expressing his emotions, started wearing shoes and full pants. His GPA improved in the school, he became independent. So improvement in eating habits. In academics, he started scoring A plus. So and slowly we have seen over a period of 2 to 3 years that he has come out of the typical autism category. This is his brain scan before the treatment, and this is after the treatment. So let us just look at his video.
He was sitting on the kitchen floor and I was doing dishes in the kitchen and I just kept saying to him, Ganesh. I kept calling his name and he would not look at me, and which was very different for him. I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that. He would walk on his tiptoes, look at the wall and be talking to the wall, or get problems with eye contact. He'd never look you straight in the eye. He'd look like that, but not the whole part of it. He had problems with his speech.
He wouldn't even allow us to put the food in his mouth, and he would just be screaming, "Get away from me," and "Stop hurting me." We were just chasing him with food constantly. We would get some of the other kids and we would corner Ganesh and we would force feed him. And it would be painful to do, kind of seem cruel as a parent, but we knew that if we didn't have him eat something, then he would have just this huge tantrum and we all would be just horrified.
I did a lot of research, did a lot of studying on the internet and books. There's no treatment, as we know, and we have to figure out a way to. We tried homeopathy. I tried for 3 months and I couldn't tell a difference.
We got him started on all kinds of supplements. We kept him on a gluten-free, case-free diet, occupational therapy, speech therapy. I started art therapy with him. We did music therapy with him.
All of that seemed to help some. It seemed to calm him down some, but it wasn't making the problem go away. The problem was he could not attend to things. He didn't have eye contact. He didn't have attention span. Did some research and found out about stem cells being done in Mexico and Panama. I wasn't too keen on doing it because they take cord blood from a newborn and inject it IV into your child. don't know what you might be getting into. That's when I found out about neurogen. But the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it. The hospital is entirely built to American standards.
The first stem cell treatment was December 2015.
Started seeing better eye contact, definitely a difference in his engagement with us, with his siblings. Teachers were commenting, well, we can tell a little bit of a difference in Ganesh, what's new, and do you think this is the stem cell treatment? We're like, that's the only thing we can attribute it to. And then things just gradually seem to improve overall. His mood was so much calmer. They weren't these horrible, horrific tantrums. They were decreasing. And when he would have a tantrum, I could talk him out of it. I could engage with him and we could problem solve. He was able to sit at the table with us. He was trying new and different foods, put the food in his own mouth and do it consistently. As a parent, it was very exciting. Now, all about taking his own shower. I have to just prompt him to get out, and he'll wash himself and he'll put his clothes on. It's very exciting. Because of the sensory issues, he could never wear anything besides a short sleeve t-shirt. So now he's able to wear long pants. Cool. And it's gone from only wearing Crocs to now he'll wear tennis shoes. And Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months. We saw the PET scan images.
So this is one case report. The other case report I would like to show you is of another, another child who came to us when he was 13 years old from Kenya. He was locked in his home for 13 years, very hyperactive, very aggressive, of course, no speech, no understanding, severe autism. With after stem cell treatment, much more calmer. He's cycling, he goes to school, he does fine motor activity, he started vocalizing. So this is another child who we see good improvement in. This is a child from India who came to us when he was 11 years old. We have like a 9-year follow-up for this child. He's now almost 20. He's completely self-reliant. He's past 5th grade, 8th grade, 10th grade, and 12th grade, and now he takes care of his sister. He can go to a grocery shop and buy things by himself. His interaction with other children, now you can see him teaching those who are hearing impaired children at home. His interaction with his father has improved. His empathy level has gone up. His understanding has improved. He can do work at home, take care of his sister, take his sister to the bus stand, go for vacations and picnics, and basically look at a camera and be photographed and follow instructions and talk to you. In a cohesive and a comprehensive manner. So this is a child who was treated almost like 8 to 9 years back, and now is an adult. So this is a long-term follow-up, and you can see him making noodles in front of camera. This is a girl. Now, many people feel, how does a girl respond? Girl from Bangladesh who was extremely hyperactive, had a lot of behavioral issues, no sitting tolerance. You can see now that his understanding improved. She's sitting much better. Her learning has improved. She's following commands much better. She can match things because comprehension has improved, matching skills have improved, command following is much better. She can follow simple to slightly complicated commands much better. And every day she is showing progress. It's been about a year since her treatment, and slowly and steadily there has been improvement. Of course, what happens when you times with improvement in understanding, the child becomes more stubborn, and parents feel that the child has become more difficult to manage or is more hyperactive. But you look at the nature of the hyperactivity before the comprehension improves and after the comprehension improves is two different things. The one, initially the hyperactivity is absolutely without any focus, and second, the hyperactivity after the treatment generally is more, it is more curiosity based, it is more the child is explorative improvement. This is an older child who's 15 years old from a part of India, from the eastern part of India, who was didn't have social skills. Speech was very unclear. He could not follow prompts and commands. Now his understanding is much more. He requires minimal tasks, minimal prompts. He can complete his tasks much more independently. His sensitivity has increased. He has spontaneous speech. Now he asks for his father. He interacts much better. And so even at the age of 15 years, with good motivation and follow-up, the parents have been able to see improvement in this child. Younger the child, better the results. Of course, you can see this child from South Africa. You can see follows commands much more consistently. Earlier, he was very difficult. He was not focusing. Sitting tolerance is improved. His understanding is improved. You can see that he is having a rapport, developing rapport with the therapist much better. Is doing tasks, simple tasks. He's sitting and allowing to complete. Is just more focused. You can see that, you can just see the focus in the child, or he's trying to escape from his chair and now he's sitting and completing his tasks much better. Problem solving skill has improved. So you can see an overall improvement in children after stem cell therapy. The same rehabilitation that you have tried before becomes more productive. This is a child from Myanmar or Burma whose mother is a physical therapist, who's very motivated, and child was absolutely severe autism, and now his understanding, his learning, his ability to follow commands, even his vocalization and speech is improved. It's a totally different child. His learning has improved drastically. He understands, he knows who is who now. He can follow commands, and progressively he's seen improvement. The most of course difficult thing is to get speech and communication, though it takes time. It does come. Most of the parents feel that unless speech comes, they don't really feel happy about the improvement. Here you can see he's sitting and focus, and he is playing a keyboard. You know, a child who is absolutely unfocused is now come to that level. So that's the progression. You have to wait for speech and communication, because unless comprehension and socialization improve, speech will not come. And even if speech comes without comprehension, it is nonsensical, of no value. So these are a few examples, and I can go on about the examples. This is a 6-year-old child from the USA who came to us a few months back and shown good improvement before the treatment. You can see a lot of stimming and no concentration. Now you can see he's sitting nicely and is actually looking at things and is responding to commands, and improved scanning, sorting is much better. He can respond to the external stimuli much better. If you he pays attention, mainly that's most important, pays attention, tolerance to activity, improved sitting and doing activities, and taking joy in the activities. Strength and balance, of course, that tone of the body is much better. Physical strength is improved. So how safe is stem cell? Overall, we do not see any complication, no major adverse events or neurological deterioration, but there is a 3% patient who could have who have history of epilepsy or seizures, or whose EEG is abnormal, could have a transient increase in seizures, but with good anti-epileptic cover can be taken care of. Spinal headache in self-limiting and a little bit of pain in for 3 to 4 days. Neurorehabilitation, very important after the stem cell therapy. It complements cell transplantation and rehabilitation, complement each other, helps to form the network. The therapy after stem cell treatment helps to form the networking and improve the neurogenesis in the brain. So activity dependent pruning or proper connections are formed after stem cell when done in along with good rehabilitation. So parents feel that, oh, we have been doing rehabilitation before. What is the difference? The difference is that with the stem cell, when you do rehabilitation, they help each other. And that's why together a teamwork is very, very important. So these are our publications and books. And I'm going to wind up now. These are all the scientific evidences available freely online. These are our laboratory GLP, GFP certified and a cohesive rehabilitation setup, comprehensive rehabilitation. So it's a combination therapy, not alone. Everything works together, but teamwork is important. So all of this will be, so there are books online available for parents as well as professionals to read. This is our core team of professionals who guide all the therapists and doctors and all our credentials. So to end with, to believe what has not occurred in the history will not occur at all is to argue disbelief in the dignity of man. So to believe that there is no treatment for autism or that children with autism cannot mainstream is wrong because it basically goes against the credence of dignity of man. So thank you for patient hearing. I know I've taken almost an hour and a half, but I did say that you will have to be a bit patient, and I'm happy to answer questions. I will be now starting with the questions. Kindly show me the questions. Where are the questions? Here? Stefan? Okay. Hello? Questions. This is what I have to see. Where are the questions? I'm sorry. Oh, how do I see the questions? How stem cell? Can you get this in the center? Hello? Josefa, can you get this in the center? I'm sorry. I need some IT help. Okay. So we have the questions here. Start from the beginning, right? There are a lot of questions. So please bear with me, and I'm going to answer each one of them. There are a whole lot of questions. Okay. Yes. Now the first question here is autism hereditary? Reason I'm asking this because I'm on the autism spectrum. My ancestors and parents and elders in my family don't have autism, and how did I get the autism? So as I had explained in the beginning, I've already explained there could be a genetic background and there could be environmental. They are not exclusive. There could be a combination, or there could be. So in some families it is hereditary. There would be could be a genetic background to it, and sometimes you may not have any precedence. Okay, so there could be a history of maybe lack of oxygen at the time of birth, or there could be some event which is missed during your mother's pregnancy or when you're coming out of your mother's womb. So it is possible that that could have caused. But like, for example, in my family, I see that autism is hereditary in a part of my grandmother's side, and I see many of my cousins and my cousins' children having autism, many of my niece and nephew having ADHD. So there is a possibility, but it is not the only thing. My name is Neha Uttam, staff in an NGO. Neha, so nice to know that you are interested in communicating. Sorry, before I ask my question, I didn't mention my name, so no problem. Thank you for your introduction. Can autism be cured through medicines and various treatments? I wanted to know. So now, first of all, let us understand that autism is not a disease. It is a condition. It is a spectrum of problems, and instead of saying cure, we say treatment. With treatment, an individual can become fully functional. In fact, there are instances in the history of mankind where there have been individuals who are geniuses and have been on the spectrum or have autistic features. Now, there are books which contemplate that maybe Albert Einstein had autistic features, Madame Curie had autistic features. There are individuals who have achieved great, have had great achievement. There are doctors, autistic individuals becoming doctors, scientists. There are models. In fact, one person has got elected in the United States. Recently there was a very good webinar by Autism Connect where a girl, Rachel, has become one of the spokesperson for autism. So yes, it is possible to lead a good quality life even with autism, with medications and treatment. Yes. Now, why more boys affected as compared to girls is still a mystery. But my guess or my money would be on hormonal influences. You must understand that hormones make our brain different. Like even a male brain is different from a female brain, and the hormones in our body tend to affect that. So though there is no clear-cut answer yet, but we are looking at what could be the reason, but maybe hormonal influences could. I can't hear your voice. Oh, I'm so sorry. I hope you have been able to hear later. Where can we find the recorded video? You would be emailed the recorded video of this webinar. Zahra Iraji, what's your newest treatment for these children? Zahra, I hope you had been there throughout the seminar. I hope you were there, and I have spoken about various options, and one of them being stem cell therapy. No audio, no audio. I hope that was corrected. Now, a lot of people have been saying no audio, and later on, can we get the slides because it is moving too fast? Is it okay? We will try to see whether we can. No audio is going and coming. I'm really sorry about that. You will be getting a video recording of this webinar. Can you share the basic questions to ask the parents on the list of identification regarding the age and health status? List of identification regarding the. I'm not sure, Leila. I understood what the question is. Could you please email me the question again? Sandil Kumar, how successful is the stem cell therapy for autistic kids? Does it completely cure the kid, and how does one qualify? How does one know whether the kid is stubborn or the kid is unable to follow instruction given by parents? It's very confusing sometimes. My daughter doesn't like taking instructions or taking help. For example, let's say there are 7 toys on the floor and 5 in the front of her, 2 behind her, and if she's trying to pick all the toys, and if I tell her that there are 2 more behind her, she gets angry and frustrated. How do I explain that behavior, what I'm missing here as a parent? Now we will need to study the child completely. Stubborn child, difference between a stubborn child who doesn't understand the commands is that if you let your child be without giving instruction, and let's see whether she plays with the toys which are behind her. So if she plays with the child behind her without your instruction, that means she knows there are toys behind her and she doesn't want to listen to what you are saying, and she wants to do her own thing. So sometimes you have to just let the child be and see what the child does with the toys. Give a little bit of freedom, a creative freedom. Maybe you can give suggestions, and see whether the child wants to. Make it more playful. Don't make it as if you are the teacher and the child is your student. Do a play with her. Do what you would like her to do. You do it and show it to her. So you have to make things more creative rather than a therapy. But Sandeep Kumar, I'll ask one of my therapists to get in touch with you, or you could get. We are doing tele-rehabilitation as well, and we could explore what your child means. If fMRI can be used, Mr. Satyabrata, yes, you are right. fMRI can be used. However, you must understand that fMRI requires an individual to follow instructions. So fMRI has been used in Asperger's or high functioning autism. When you put them in the MRI machine, you have to give instructions of certain thoughts or processes, and then the brain scan is done. Now imagine a child with autism. It's difficult to do an MRI without sedation or anesthesia. And as of yet, functional MRI for sedated individuals is yet to come into clinical practice. We are looking at evolution of resting functional MRI. So resting functional MRI is something which can be done in sedated individuals, and hopefully that is the next step where we can, get away with doing not doing PET scan. Ma'am, is the volume of amygdala reduced in ESD? Surely, volume of hippocampus is increased. In fact, volume of amygdala is not reduced. The functioning of amygdala is reduced. Now, interesting thing about the brain, both combining Mr. Satyabrata's suggestion and Cheryl's question here, I would also like to just let you know a brief study which is being done and not yet published is that the brain connections known as the corpus callosum, the formation of corpus callosum seems to be qualitatively and quantitatively affected in individuals with autism. So that is something which we are studying, which is seen by MRI DTI. MRI with diffusion tensor imaging, which shows the connections of the brain, though reported by the regular radiologist as normal. When you put them into special softwares, we are able to study the difference. That is something which is study is ongoing. Are there any side effects of stem cell therapy? At the end of my presentation, I have discussed the possible side effects. It depends on the type of stem cells that are used. Stem cells taken from the patient's own body are safe. There are no rejection, but you're stimulating the brain, and hence there is a 3 to 6% chance of triggering seizures in those whose EEG is abnormal or who have history of seizures. But with proper anti-epileptic cover, that can be covered or that can be taken care of. At what age an autistic child can take aquatic therapy? As you know that 6-month-old child can also learn to swim, right? So earlier you put the child into water, the better. I don't think there is really an age there. Which profession give aquatic therapy? Physical therapist, occupational therapist who are trained in aquatic therapy can give aquatic therapy. Is it true that biscuits increase hyperactivity? No, that's a very good question, Cheryl. Biscuits, those which is made of either wheat or maida, which is a very fine flour, could cause indigestion or digestive issues, leading to a lot of gas formation, and could thereby cause increased hyperactivity and restlessness because of abdominal or gastric discomfort. Ma'am, can you explain chelation therapy in detail? Okay. Okay. So let me explain chelation therapy in detail. So chelation therapy is generally conventionally used in, for example, let us think about a sickle cell anemia patient. A sickle cell anemia patient has problem with red blood cells and keeps on getting blood transfusion. That causes an overload in the iron in the body because too much of iron from the blood, and that cannot be removed. That causes a pressure on the liver and kidney. Now, chelation was generally done. It is a chemical which is injected intravenously. Now there are chemicals which can be taken orally. These chemicals will go and bind to that heavy metal and make a combination or a molecule which can be then removed from the body via urine. Okay, so that is known as a chelation. Now, in terms of heavy metals like mercury and lead, chelating agents like DMSA is used. to remove the heavy metals from the blood. So it's an injectable, and now as an oral, you have to do it multiple times. Injection requires proper medical supervision. Oral also has to be done with the, it is supposed to increase the urinary excretion of heavy metals. Thank you for webinar. I really loved your content of discussion, Himani Pansal. Thank you so much. I can't hear again, Oyin Mole. I can't hear anything. I'm so sorry. I hope this was audio is not clear. Oh God, Dr. Vinay. IT people, please have a look at this, and we will send you an email with the any hypothesis as to why the brain metabolism of ASD kid is better than during the early years of. I think it has been seen that the brain volume is higher in children with autism, especially hippocampus volume. So maybe the metabolism is higher earlier. And we do see, if we see very active children earlier, and over a period of time, it could reduce. Now I could, put my own theories there. But yes, the activity of the brain seems to be higher. Yes, I mean, not very sure of that. I'm sorry. What will be the cost for stem cell therapy, Sunil Kumar? Someone will connect with you and give you that information. What is the duration and cost of stem cell therapy in India? In different centers, the duration is different depending on how the treatment is done. At Neurogen, we do a 1-week treatment, Sunday to Saturday. Sunday, Monday, we do assessment and scans. We do look at the complete blood workup to see whether fit for the treatment. Then 1 day of the stem cell procedure, followed by 4 days of rehabilitation to help the patient basically cope with any immediate possibility of side effects, as well as to initiate the rehabilitation. How to collect and what is mode of administration with stem cell to collect? Bone marrow from the patient's own body is removed, stem cells are separated, injected intrathecally. I have talked about success rate also of effective treatment. Sarmila, I think I've answered these questions eventually. What is the cost? Is whether FDA approved, FDA USA not yet approved. It is FDA US, this is done in India. So basically, whether stem cell is a drug or not is still a controversial topic. It is still in the process. There are different types of stem cells, those which are taken from the patient's own body. We are basically sending a contention, or in fact, we are talking to the government of India about it, saying that those which are taken from our own body and injected in our own body should be considered not as drug, which hopefully we get accepted. Those which are taken from the body and multiplied or taken from somewhere else would be then considered as drug, and then will need to undergo various clinical trials. Well, what are pluripotent stem cells? Pluripotent stem cells are cells which can multiply manifold and form different types of cells in our body. And almost all types of cells in our body, those are pluripotent stem cells. Till what age can we administer? From 8 months to 80 years, it can be administered. What is your opinion using meds such as Ritalin or similar tablet for helping with certain ASD symptoms? This seems to be, yes. It can be used if you see that therapy is not helping. Ritalin may help to improve the concentration. It has been seen, and if it does work on certain children, but it should be tried after trying rehabilitation. What is the difference between ASD and ADHD? ASD, there are certain criteria to label an individual or a child autism in the spectrum. ASD is just hyperactivity with lack of concentration, and some children with ASD may have comorbid ADHD also. This seems to be still popular where okay, Lisa, yes, I know Ritalin is used a lot in South Africa. How do we reduce self-hurting behavior in children with autism? Self-injurious behavior is a sensory plus a behavioral issues. One, early intervention, start with therapy. As comprehension improves, self-injurious behavior would reduce, then you can, because you can then rationalize, tell the child what is right behavior and what is wrong behavior, and also look for any gut issues or any other problem which is leading to discomfort in a child, which could lead to a self-injurious behavior. So we'll have to look at the problem at various levels. When the child reaches a teenage, self-injurious behavior sometimes increases. That is a response to the hormonal influence, because the hormonal influence, the child is growing physically but cannot comprehend what is happening to him, to his body. So we will have to look at the age of the child and what are the other confounding factors which are leading to the self-injurious behavior. Rehabilitation and some amount of medical help can really help it. Ashwini Ravikumar, interns allowed at your institute. Yes, please do come and work with us. You should work for at least 6 months to understand what we are doing. Yes. My son is 6 years old. He is under ESD. Please let me know what is the chance of recovery. Yes, Subhashish, good chance of recovery. 6-year-old child. You have time to work on him. Whatever, do aggressive intensive therapy and rehabilitation. Do try all types of treatments. He has good possibility of recovery. Unnati, yes, my mother has some neurological issues. She forgets region. She went out without shoes for. It could be a start of dementia. Yes, and yes, you could use stem cells. Please do get in touch with us. We would help to evaluate. Why is there so much information on research or endorsing stem cell? How many can afford what? How much is it accessible? We are layperson interested in helping beings with autism. While a lot of information, I've given information on everything, and stem cell, because Neurogen Brain and Spine Institute does, and a lot of people have spoken about everything else, and stem cell is something which had not been covered. It is very much accessible and affordable for everybody. And Leila, I'm not sure what you're trying to say, but information is good to know about information about everything. So, for example, I'm sure there have been topics on all other topics so far. It's good to know what new is happening. Yes, Subhashis, you can get all publication PDF available online, and that will be sent to you. If we take the stem cells from spine and inject at the same place, how will it help? Now, we are not taking from the spine, we are taking from the bone marrow in the hip, not in the back. Bone marrow is inside the bone. It is a red blood, thick blood kind of a thing, from where stem cells separate, injected into the spinal fluid. So these are two different locations, and we are injecting into the spinal fluid, which is near the brain and which can reach the brain very easily. Himani Tyagi, somebody will reach you about the cost and complications I have explained. After stem cell therapy, how much time the improvements become noticeable? 3 to 6 months minimum it will take, Nabanita, to see the improvement. And Dr. Nabanita, it will, as long as you continue to therapy, you will see improvement. Contraindications, I have mentioned contraindications, tumors, malignancies, viral infections, low hemoglobin, blood disorders. There is no improvement. After how much time can we repeat? We would at least like to wait for 6 months to see the changes with good rehabilitation. Then we do a PET scan again, and then we can decide about another treatment is worth doing it. What is the cost, Neeraj? But logistic details will be explained to you by one of my colleagues. At what age it is recommended to do stem cell therapy? What if we do not have the cord blood? Yeah, you don't need the cord blood. We can use the patient's own bone marrow stem cells. Earliest age that we have treated autism is when there was high risk of autism is 18 months to 2 years. How much of this whole process costs? Tasneem Motiwala, you will be explained about the treatment cost soon. Yes, it is affordable, Madhu. If a child with Down syndrome autism undergoes stem cell therapy, yes. And it Down syndrome can also be helped with stem cell therapy. Positive role of massage in controlling, yes, massage should help, Leila. We have seen it would help to calm down the child, yes. Stem cells will be used for other neurological condition also, Saguna, cerebral palsy, intellectual disability, spinal cord injuries, head injuries, ataxias, muscular dystrophy. This turns out to be advertisement for personal. This took much of the webinar time. I think I took 1 hour to explain what are the causes, what are the early features, and what are the other types of treatment. I meant stem cells. Manish, stem cell administered intrathecally. Tools for assessing the child, you will need to go to a psychologist or a developmental pediatrician. Shividya, you need to reach us and we need to evaluate each child. Pawan Reddy, somebody will reach you. Very informative. Do we need to take any medicine after stem cell therapy? Whatever medicines are being taken need to be continued. No special medicine for stem cell therapy. Fatima, yes, somebody will reach you about the cost. Will it help in Rett syndrome? We will need to evaluate the child. Early Rett syndrome, we could help to stabilize the condition because it is a degenerative condition. So we will not help recover completely, but we can help to try and reduce the severity of the problem. Email ID, email will be sent to you. Kanika, thank you so much. Vinita, we do have criteria for selecting patient. We do a complete assessment, understand the patient's condition, and only then we select the patient. Yes, there would be criteria. Any RCT, we are looking at doing an RCT of stem cell with rehabilitation and rehabilitation alone. Randomized placebo is not possible. No parent will allow bone marrow to be removed and not injected and only placebo to be injected. But we are looking at doing stem cell therapy alone with rehabilitation and rehabilitation alone. Shivani is asking, do environmental factors and genetic factor both contribute to ASD? Yes, is both factors, sometime in combination, sometime alone. Mostly in combination. What is the cost for a 4-year-old means? Saurabh, somebody will get in touch with you. When a child already has epilepsy, can he be treated? Shivani, epilepsy needs to be controlled. We have treated many children who have comorbid epilepsy. We don't treat only for epilepsy, we would treat for the autism, cerebral palsy, or intellectual disability, which happens along with it. But yes, can be treated if the this is controlled. How many settings are required? We do one treatment, wait for 6 months to a year, look at the effect, and then decide about another treatment. Genetic basis of yes, there are disagreements, and it is not strictly genetic always. Money. There are certain gene conditions which give autistic features, which give features like intellectual disability, but not all children may have a genetic background. And even if there is a genetic predisposition, a child may not always end up being autistic, right? So there would be environmental factors which contribute or trigger. So, for example, let me give. We had a family with triplets with autism, and each child showed different phenotype. So even if we think that yes, there is a genetic background, the child's severity and functioning is a lot depend on how the brain ambience is. So stem cell actually helps to improve the brain ambience. HBOT improves the brain ambience. Rehabilitation improves the brain ambience. So improve the environment of the brain. What if my child doesn't improve after one setting? I hope it doesn't happen, but there are certain cases. We will evaluate what is the cause, what could be the reason, and we'll try and rectify it and see what can be done. My son is having mild, Soumya is saying my son is having mild symptoms, not expressive, no social, non-verbal, 3 point. What is the risk? Was at risk of autism, undergoing various therapies. Improvement is there. Do you suggest stem cell therapy? No, the decision about whether to go for stem cell therapy has to be the parents. If you are, satisfied with the way the therapies are helping him, then you don't need stem cell therapy. But if you think that even with all the efforts, you are getting progress, but you are limited somewhere, there is a block, then stem cell along with rehabilitation could help you progress faster. Nirja, the cost will be explained to you. In elderly, Geeta, depends. Yes, in elderly and adults also we do see improvement, but depending on the disorder. Adult autism, very few adult autism have seen good improvements. It depends on the age, yes, but those with stroke and ataxia, but definitely the results are much better in younger children. Are you calculating CD34 or MLC before infusion? Yes. We are calculating the mononuclear cells, the viability as well as counts before infusion, and we are checking for the CD34 counts as well. What is the average lifespan of a person with autism? If the child doesn't have any comorbids and if the child doesn't have any other systemic effects, lifespan can be, as much as for you and me. If mother is espoused too much of a phone radiation, does it affect a pregnancy chance of having autistic child? There are certain publications or scientific work, Lata, which have suggested that keeping the phone too near the womb or could be one of the causes. Could be. So it is not like 100% association causal effect, but there is a side possibility. Is autism a birth defect, or it can be formed in a child who was healthy when they were born due to poor parenting and environment? There could be a predisposition because of some birth issues which may have got unnoticed, and it would become obvious or manifest after a couple of years, or maybe in a year and a half. I won't say poor parenting, but yes, environmental factors, or like leaving the child alone, giving too much of lone time and screen time tends to bring out the possibility. And the other way around, when we see that when the child is with so many people, with grandparents, and with you have a very enriching environment. That's what I tell parents: enriching environment. Then you see that the child social relationships develop, and thereby the severity of autism goes down. A 5-year-old child with hearing impairment, autism, can he benefit? Hearing impairment seems to one of those factors which tend to reduce the possibility of success. Though if the hearing impairment is at least corrected with hearing aid, it could assist. Or the other way around, when we have treated a couple of cases with autism with hearing impairment, where a child with autism would not keep a what to say, a hearing aid, but with treatment and therapy has become calmer and has allowed to keep the hearing aid. So hearing impairment will not respond to stem cell therapy, but autism can. Hello, ma'am. Seema, as you said, one of the causes are ages of the parents. So what could be an estimated of parent for healthy child? Looking at the age, maybe between, these are estimates, but maybe between 25 to 35 would be the best age, because as the age increases, the possibility of any genetic conditions or any other neurodevelopmental condition increases. Can we get PPT? You will get a video recording. What about risk of infection due to handling of stem cells? Any cytokine release syndrome you have seen in your previous patient due to infusion? Risk of infection is always there, but in our experience in the last 11 years, we have zero infection rate because it is handled with utmost care in GMP facility lab. Cytokine release syndrome, no cytokine, because these are the patient's own stem cell. So cytokine release will happen, but not so much that it will cause a negative effect. In fact, these are immunomodulatory cytokines will reduce the inflammation. In fact, stem cells have been shown to reduce inflammation. How many days this process take from admit to discharge? Precaution course, 1 week, minimum 1 week. Post surgery, we have to take care the child doesn't fall ill or doesn't have fever. There would be certain tests before treatment for fitness. How does stem cell therapy score over fecal microbiota? So you can't really compare the fecal microbiota transplantation. Fecal microbiota transplantation is a local phenomenon to improve the gut issues, while stem cell therapy helps improve the brain functioning, which controls the whole body. So you can't really compare. What is duration of this whole process? Stem cell rehabilitation, 1 week. Source is the patient's own bone marrow. What kind of children are playful? One with hyperactivity or the silent. Those who are hyperactivity would be more playful, yes, but they may not have relevant play. Can you please give rough idea of cause? Shidul, I cannot give rough idea, but somebody will reach you. Thank you for insight. Thank you, Shivani, for appreciating. My 2.7 year was having lack of oxygen when he was born. I was born with 3.5. He underwent hypospadias surgery 2 times. He's not picking eye contact and no speech, lining up toys. diagnosed high risk started behavioral therapy. For how many years is therapy to be continued? So you have to do therapy till the child reaches an optimum stage where you can at least get the child into school and have an education. So when people ask me how long the therapies have to go on, I ask them, when you put the child in school, do you ask them how long do you have to keep the child in the school? You have to keep the child in the school till the child graduates. Similarly, when the child loses his diagnosis or his what to say, sensory issues reduce, and the child is able to perform academically, accordingly what he requires changes, like the syllabus changes every year. Accordingly the therapies will also graduate from one to another. Sanam Nair works in neurodevelopmental therapy department, Spastic Society, work with children with my question is, children with autism and grown as adults can become socially normal, live an independent family life. Can they get married and give birth to children and become socially responsible? Depends on the level of autism, and yes, I think depending, if it's severe autism may not be, but a mild autism and high functioning will be able to one function independently, yes. If as the child, if he has social interaction and starts developing emotions, should be able to live an independent life and get married. But the main issue here is social interaction. So it is possible, though I think the number of people are less. You may need to connect them to similar people, similar individuals. Does the age of a woman at childbirth affect the possibility of child being born with autism? Yes, Tessie, and other neurodevelopmental conditions also. I'm pleased to tell about social communication skills development therapy help us. It requires occupational therapy as well as speech therapy put together, and a lot of play therapy. So play therapy will also help you in social communication. If this is treatment is must advise if not popular for autism, Pradeep Dubey, it is popular. It is becoming popular. Is there a branch of Neurogen in Bangalore? No, we are only in Mumbai at this point. We have permission DCGI. Government of India has banned genetic cell therapy. Not really banned genetic cell therapy. There are people doing it for cancer still, the natural killer cells. DCGI permission is, as I explained, the two things. There is still no clear-cut guidelines. They are coming up with guidelines where they are differentiating between the type of stem cells. So depending on autologous, minimally invasive to minimally manipulative to maximally manipulative. So depending on that, the guidelines and the recommendations would differ. And DCGI is coming up with our recommendation, hopefully with something which will differentiate the types of stem cells yet. Ma'am, except CARS, ISA, is there any diagnostic tool currently used? Except CARS is used, ISA is used, and you could use ADOS. It is a very lengthy process though. And I think MCHAT, and then there is GARS, there are different scores which can be used, yes. Nalini, cost will be explained to you. I don't think this is a forum where I should explain the cost. Can you please explain criteria for selecting ASD for stem cell? The age of the child, the condition, whether there are any comorbids, whether there are any viral infections or any other. So generally a healthy child with no comorbids would be considered for stem cell therapy. Himani is 6.5 years with some abnormal gene in her body, severe intellectual disability leading to global developmental delay. Himani, we will need to really evaluate the child. We should be able to help, or roughly yes, but we'll need to. After SCT, do you also give multidisciplinary therapy to each child? Is this part of SCT treatment? Yes, yes, definitely multidisciplinary treatment is a must, Vinita, after the stem cell therapy. It's compulsory. Okay, Shubha is implanted listening well, very good. So yes, we should be able to help the brain development. Is it a one-time therapy or repeated depending on the severity of the condition, both clinically and on PET scan? We could give you a possible readout whether another treatment will be required. How can age of parents be possibility of a child being autistic? What happens is that the age increases, the possibility of mutation in the ovary. So you see a lot of Down syndrome also in older age children, parents. No, that way genetic conditions and other also because of age, the womb of the mother is also has aged, and there are a lot of factors. So the body of the parents has undergone a lot of changes, environmental factors. All these will contribute to overall neural developmental condition and neuropsychiatric condition to be more. Yes, video recording will be emailed to you, Sharon. Can ataxia be cured? Could be treated. Ataxia is a degenerative condition. I will not say that it can be cured, but we can help to stabilize the condition. Thank you for information. Madhu says, looking forward to more. Thank you so much. Anu, Rupa, we have twins, boys and girls, 5.5 years. Boys, especially hyperactive, cannot sit in one place. Girl is much better. Boy has gut issues. We have put both in inclusive. There is good improvement, but in boys' case, it is slow. Will there be improvement with stem cell therapy? Anu, Rupa, we could consider. Yes, I would say it is worth looking at. And what is the minimum age we can diagnose autism? Sometimes those who are alert parents, they start seeing difference at the age of 12 months also. So we won't label the child as autism. However, the risk of autism can be ascertained between the age of 1 to 2 years. So you can diagnose possibility of autism, but the child will be labeled as autism only after 3 years. Stem cell therapy can be considered in autism as early as 18 months to 2 years. We need to have a weight of 9 to 10 kgs. Okay, I think, are we done now? Or we still questions are coming in? Surekha Ganti, what are the advantages of stem cell therapy over other therapies like? No, please, again, I'm saying stem cell therapy will not be over occupational therapy and ABA. Occupational therapy, ABA, physical therapy, speech therapy, special educators are the pillars of treatment for autism. It will be complementary. It is not over each other. Okay, so it has to be done together. Never ever we can never say that it is one over the other. Okay, what it does, however, is all the therapies, whatever the results you are seeing with stem cell therapy, you will be able to see results along with these therapy faster. So it will not be a substitute, it will be complementary. So if stem cell therapy can do 2 and rehabilitative therapies can do 2, together they could achieve 5, 6, and 7. So thank you so much for patient hearing and such an interactive session. And I hope that you have got a good sense or understanding of the field of regenerative medicine, and I've been able to some of the myths and negatives about it. I've been able to try and clarify it. And do get in touch with us if you have any more questions. I'll be available on the email ID here. And have a good day. Take care of yourself and be safe.